Hello friends of Dental XP. Today we will talk about the short length implants. When we have a situation in which a mandible presents with a highly resortive pattern on the posterior sides, the use of short length implants may represent the ideal tool to treat a case. We can have a case like the one we are seeing, in which the patient had an implant restoration with a cantilever distal ending on the restoration. A radiographic BTI scan was performed, and we can see very clearly that if we want to place implant on the distal area of these restorations, we need an implant with a length of 7 or 7.5 millimeters with a diameter of 5 or 6 millimeters. One of the advantages of the BTI radiographic scan is that it will also give you the bone density of the areas where we want to place the implants. This information is extremely helpful in determining what type of implant should we place. A full thickness flapless raise with a mid-crestal incision, and the osteotomy preparation will be performed with the BTI osteotomy technique. The BTI osteotomy technique is a technique in which we use a low revolution speed. This use of low revolution speed will allow us to collect some of the bone that is derived from the osteotomy preparation site, and it will also allow us to be quite accurate and very minimum invasive on the preparation. Another of the advantages of this BTI low speed technique is that it will give you a very precise control on the depth of the osteotomy. As well, we will be extremely precise on the angulation on the osteotomy. Once the osteotomy is finished, we will go to the implant, we will wet the surface of the implant with PRGF, and the implant will be placed on the final osteotomy previously prepared. When we work with short length implants, we will always do it on the two-stage approach. We will place the implant, leave it submerged, and come back on a later stage and uncover the implant. The bone that was collected while the osteotomy was performed will be then placed with a PRGF, and the area will be sutured and left for the healing period. After the healing period has been achieved, the implant restoration was performed. We can see the implant on the final radiographic image where the implant has been restored and is in normal function, and we can see how the short length implants allowed us to treat perfectly this case.